welcome to the Men's Health Month of Blue November. For this whole month, I'm going to dedicate it to prostate cancer. We're going to start with the diagnosis itself, and then we're going to talk about various types of treatment, including robotic surgery and radiotherapy. And lastly, we're going to talk about hormonal treatment and the impact on sexual health. Prostate cancer itself is mostly diagnosed by a screening process called a blood test of a PSA. PSA stands for prostate-specific antigen. Sometimes people call it persistent stress and anxiety. Why is that? PSA, as the name suggests, is very organ specific because it's only produced by prostate itself, and women will not have elevated PSA or any PSA at all. However, when the PSA is elevated, we can't be 100% sure whether it's a malignant cause or a benign cause. So that creates a lot of headaches for both patients and also doctors. However, there are a few things that we can do. For example, when the PSA is high, we want to make sure that there's no infection. We sometimes give patient medications such as antibiotics to see whether it can bring it down. And occasionally, we ask patients not to do certain things before you do your PSA blood test. For example, cycling itself can actually elevate your PSA. Ejaculation before the actual blood test can also elevate your PSA. And digital rectal examination can also elevate your PSA. If your PSA is truly high, then you need to undergo several tests. You need to go through a digital rectal examination. Ouch! Actually, it's not as bad as you think, because a rectal examination is of just a single digit in order to make sure that the prostate is not nodular in characteristics. And following that, some people might undergo MRI scan, which delineate areas of abnormality, or a direct investigation such as a biopsy. And if we really need a biopsy, the biopsy itself will delineate whether this is a low-grade cancer or a high-grade cancer. And following that, we need to do something called the staging process. Hopefully, the tumor, or hopefully there's no tumor, but if you are unlucky enough to have prostate cancer, hopefully it's detected early, then the cancer itself is organ confined, and curative intervention will make sure that you're free from cancer. So for the second part of the prostate cancer special in the month of November, we're going to talk about if in the event that you've got prostate cancer, if this is organ confined, then you stand a very good chance of having a radical prostatectomy that will cure the cancer. So if you want to find out more about radical prostatectomy done by robot, then you stay tuned for next week's Putting Dr. G on the Spot.